Good morning. Right now it is 10:20, and we are going to be talking to Dr. Yvette Poindexter, and she's going to be sharing about an opportunity that you have to get pre-screened, and then you will also be able to get tested for COVID-19 for free. So we're going to learn everything that they have going on, and it's going to be a good time. Here we go. Good morning. This is KHEA Radio 99.5 FM. I have a guest. I'm going to let her introduce herself, and we're going to learn everything that she has going on right here in Galveston, Harris, Brazoria County, and it's all over. But good morning, doctor. How you doing today?
Hi, good morning, Gardy. Nice to be here with you all today.
Yeah, I'm excited. I'm excited to learn. Can you share the organization that you're with and the role that you play?
Hi, I surely will. My name is Dr. Yvette Poindexter. I am the Chief Medical Officer with Community Health Network. I've been with this organization since 2010. So I'm very excited today to be here to offer what we call, community support, uplifting the community concerning COVID-19. As you know, we all have had experience with this over the past 3 months in many ways than one. So what we are doing as a community health center, we are providing COVID-19 testing at our different locations. We actually have 12 site locations throughout the different counties that you mentioned earlier. But one of the main reasons we're here today, that we have a location that you mentioned in support with United Way, that in the Galveston County area, that you can be pre-screened and tested for COVID-19.
So to be qualified, like the pre-screen questions, what kind of things are they going to be asking? So the people can know, like, hey, should I call?
Yes, when you call in, you'll call into our number that you'll reference again during the call, which is 281-824-1480. You will receive a response by our patient services. They will perform a pre-screen with you. The pre-screen has evolved over time, as you've noticed that so have recommendations over time as well. But some of the questions they'll ask exposure to a person with COVID-19, symptoms, which the symptoms have also evolved over time, which may be cold-like symptoms, it might be diarrhea, could be loss of taste or smell. But one of the most recent that we've really expanded the testing to different persons include asymptomatic persons. We're finding, those priority testings should be performed in certain age ranges, such as if you may be pre-screened if you're 65 and above. Also, if you have health conditions such as diabetes or hypertension, asthma, COPD, chronic conditions that may put you at higher risk. Other professionals, such as healthcare professionals, which we call them, but that qualifies for a lot of persons that just may be in the healthcare industry, qualify for asymptomatic testing, as well as there may be racial disparities as well. We've noticed that over time and amongst the Black and brown persons. And so, we will, talk to you, make sure that you qualify for testing, because it's important. I know that persons are concerned, well, maybe we don't need to get tested. Well, let us decide that. It's better, I think, to call in and be pre-screened for the testing, and let us see if you do need testing because of your risk factors.
Okay. So how long have y'all been doing this testing and offering it for free? Is this something that y'all have been doing, the past couple of weeks, or is it just now starting up?
No, it's been going on. We've been involved in first of all, we stayed with the community as this unprecedented time begun. We did not, shut down operations because we knew there was a need. There are going to be those persons that could not afford healthcare at that time. And so, with a lot of successes with other collaborations and partnerships, we have been able to afford to test persons for free. Now, it did evolve in the very beginning, and as well as now. We have to watch out and remember that it's not all COVID-19 diagnosis. We had flu when this first started in March, influenza, allergies that are very, very big at this time. And at this time, so there are other health conditions. So we did provide, telehealth, and we still provide telehealth with a visit if it is necessary. But the cost, there's no charge to the person. So that has been just a blessing to be able to do that.
What does the testing entail? Because I've heard some things like, oh, it's scary, or it hurts, or there's a blood test and there's a swab. So what kind of testing are y'all doing there?
Oh goodness, let's don't get started on that. That's another
Yeah.
blog. My CEO, Mark Young, he actually has been writing a blog on this because he's been very supportive with this, but testing has evolved over time as well.
Mm-hmm.
Just as the criteria, the eligibility for testing, the nasal, it was a nasal swab, which is through the nose, and then there was a pharyngeal swab, which is in the mouth, or sort of back in your throat area. And so there were two swabs at first that needed to be performed. So of course that's uncomfortable. Then, now it's evolved to where it's called a viral test. So the viral test, that is the most accurate testing. It can diagnose an active infection. Then you had what you see around, I'm sure, in a lot of places, is what we call the antibody test, but now it's evolved to the term serologic, which means blood testing. That is a different test. We've always aligned with the CDC recommendations, and with those CDC recommendations, we cannot say that the antibody test is naturally recommended for an active infection, but it could diagnose a past infection.
Oh.
So that is serologic testing. So when we're testing out there, we are using the nasal swab, the viral test. We have to be, very careful about the risk of a false negative, meaning you might really have an active infection, but that test shows up that it does not, that it's showing that it's not, it does not show an infection.
Can we talk about you? So where are you originally from, and how did you end up in the medical field?
Oh boy. I am originally from Prairie View, Texas. Prairie View is really where I practice now in Alvin. It's in relation, it's really not that far. I used to take trips to Alvin, Texas, as a young child with my parents. My father was an educator at Prairie View A&M, and took trips there. So I knew of the area very, very well. But I've been in Texas all my life, and also, just worked within the community all my life. I was a candy red striper. I really wanted to be a veterinarian. So now, how I got into medicine, I was allergic to animals.
Oh, okay.
So my dad said he was a veterinarian as well.
Uh-huh.
And that's one of the reasons why I wanted to do so, because I used to go up to the vet hospital with him. But I was always sick. And so we found out that I was allergic to animals. So he said, well, you know what? The next best thing is I want to keep you in, clinical care. And this is what you want to do. So, I went to Spelman College in Atlanta, and went to University of Texas Medical Branch in Galveston as a medical student, and residency at Baylor College of Medicine. And I chose my field, OB-GYN, because it reminded me of helping the whole person. when I went through medical school, I like to have a happy ending. And for the most part, obstetrics always gave me that happy ending. But I was also able to practice wholeness and of women's healthcare. So, coming to Community Health Network, I came here as when it was Stephen F. Austin, we rebranded into CHN, and I was able to, with the support of the CEO who came at the same time, able to branch back. I worked in primary care, but I was able to branch back into women's health. So women's health, we do obstetrics here, we do women's health, we also provide behavioral health services and dental health services as well. So, I was able to come back and do what I wanted to do originally, which I said I wanted to do, was work in the community. And I'm here, 10 years later. Thought maybe I'd leave, but I'm still here.
Yeah.
So, I'm loving what I do. And, this is what we do every day. So just giving back, uplifting the community. And so we decided, we have a location in Galveston, we have locations in Galveston. So let's get into that community too. We want everybody to know that we're here. Community Health Network is here. We haven't left, and we want them to know, because we were there through Hurricane Harvey, and we're just here, Gardy. I just appreciate this time to highlight what we do.
How are y'all able to offer, things for free or at a low cost?
How are we able to offer that? Well, I'll tell you, we offer services as a community health center. We're what you call a federally qualified health center. So that is a little bit different from what your private practice sector may do. We did the original granting was federally supported. With that now, we are self-sustaining, but we benefit from the partnerships and collaborations that we perform in the community. The United Way, we're grantee of the United Way. We've had other successes with Episcopal Health Foundation. We do work, to be successful with other organizations, especially in the Galveston County area. We work with Gulf Coast, but our services itself, we work hard to provide those.
Mm-hmm. So with businesses being able to open back up, and it seems like the regulations are getting a little bit more lax, a lot of people may not be paying as close attention to social distancing or even, wearing a mask, washing your hands, the things that the CDC originally laid out. Is it important for us to still be doing those things?
It is very important. First, the testing that we continue to perform, the governor was, he asked that, gave us a charge to perform this test, at least 30,000 a day. Based on that and community health network support, we are achieving, we're not achieving 30,000 a day, but, we've up to cumulative now almost done 3,000 testings in our different site locations. And we try and meet that, but it's important for people to continue to get tested, regardless if you're reopening, regardless of the reopening in phases, to practice the social distancing, wearing the mask that we ask you to wear. Also, the hand hygiene is very important. Washing your hands, not touching your face as I'm doing, but I have hand sanitizer right below me right now.
Me too.
So yes, exactly. So it's important to do that, regardless of wherever we are. There are predictions. As we know, influenza season will hit in August. There are also predictions as far as COVID-19, the return of it as well. So, let's get in these good habits to practice these everyday requirements so that we can prevent COVID-19 and the exposure. But at the same time, we have to remember that there are other disease processes that can mimic COVID-19. So those things are more common. And so, you just need to check with your health provider to determine if that's necessary. As far as the testing goes, the importance of that is also the contact tracing. So if you are positive, for COVID-19, we can immediately have you isolated or quarantine so that we can reduce the exposure to other persons. I just want to also talk about the contact tracing and give kind of a disclaimer of what persons may believe. The contact tracing is voluntary, from what I understand, and it's only so that we can again reduce the exposure to other persons. It is not meant to look into your actual your address or where you live or to follow you or anything like that. So I want to try and help just provide some education on that. So we encourage you to continue to get testing so we can reduce the exposure if you are positive with COVID-19.
Okay. One thing that I see is daily reports from, I see the city of Leak City, Galveston County, these health organizations are releasing numbers and says, this many people tested positive. And then I'll go read the comment sections because it gets wild in there. Everybody's an expert, but I don't see any experts necessarily like commenting back, right? Like legit experts, but they always say, well, it takes, 14 days. This is from the beach openings. This is from, Memorial Day. This is from the business phase 1. How long does it actually take for these symptoms to set in before you, I'm just asking about those numbers. How long does it take symptoms to set in?
So what we're seeing is somewhat like you explained. It's a lag.
Mm-hmm.
We're doing the testing. We've expanded the testing. We're recommending the testing, and then here we see these increased numbers. I believe a couple of days ago, there may have been 1,700 positives that came in. From our experience, I can speak from our experience. We experienced the same because we have expanded the testing and increased the testing. The numbers, the tests are coming in into probably 3 of your main labs. And so those labs, the equipment gets overwhelmed. And so, yes, we've noticed that it used to be that there was 3-day lag time for the test to come in. And over the past couple of weeks, we've seen an increase, sometimes up to 5 to 7 days. And for, like you said, on reports, we've seen even longer than that. So then we get these increased numbers that come in. The other thing is that the way that the labs are being surveyed, that's something that we will have to learn to build upon. These are unprecedented times, as you see, as everything is evolving. The tests we give, we receive surveys once a week to report on those tests. Originally, it was just report the number of tests done, the number of positives. And now we've evolved to report the race, ethnicities. And over the past week or so, we've evolved to now report the viral versus the serologic testing. Yes, the testing has changed from the type of testing we've done, the viral, the serologic, to the time that it takes for the labs to return, and as well as the type of reporting we're giving back so that Health and Human Services can can report these numbers on a federal level, on a state level.
Here's another question. This one's from Mr. Cleveland Lane. He asks, how many times can you be tested? Which is a good point, because I'll see some people get a clear test and it's like, hey, I'm good to go. But that doesn't mean that you could run into it like even the next day or later that day.
Oh, that is very true. So if you're tested and you receive a negative test, especially if you're asymptomatic, remember I mentioned earlier that asymptomatic persons could be tested. Then you can get a negative test. But if you develop symptoms later, we may test you again. So then you may have to be tested again. The other is that maybe your symptoms, and this is why I talked about the testing, the viral testing versus the blood or the serologic testing. If you don't, or you have symptoms and it's early on, they're thinking that 10-day window has decreased to 2 days prior, that most likely 2 days prior you had an exposure. Within that 2 days, you should have a response by your body to produce that positive result. So in that first 24 hours, you're right, you may come up negative, but after that, in the next 48 hours, you may have a positive test. So sometimes, if we, by the provider's discretion, yes, we may need to go back and test you again. We have tested persons within an early window and they were negative, and we came back and retested and they were positive. So that 2-day window is very important.
Okay, right now it is 10:42. This is KHEAradio.com, 99.5 FM is Kickstart. My name is Gardy. I'm talking to Dr. Yvette Poindexter. She's with Community Health Network, and this week at the United Way, Galveston County Mainland in Texas City, they're right off Texas Avenue, 2800 Texas Avenue. They are doing free COVID-19 testing, and you need to get pre-screened before you go out there. So that phone number is 281-824-1480, and that's in the description of the video on Facebook. So if you are listening on 99.5 FM and you want to, hey, I can't remember that number, just go to KHEA Radio's Facebook. It's right in the description of this video. Give it a call, and you can find out if you are qualified or meet the requirements and go out there and get tested for free. Dr. Poindexter, is there anything else that you would like to share while you're here today?
Yes. As I shared with our team this morning, we huddle every morning just to make sure we're doing the things that we need to do, to get ready for the day. I shared this morning that, in the midst of it all, it's been a challenging time, especially for us as healthcare providers, but it's also been an uplifting and gratifying time that we are able to do this at Community Health Network, support the community, and continue to be here to make sure that we all remain safe. But let's not forget that of all the things that are going on today that we've seen in the past couple of weeks, that COVID-19 is here. It's still here. It is not has not gone away. We're still receiving positive tests. So it is important for us to get pre-screened and to see if you are eligible for testing. So I would encourage us all, to do that, to look at a pre-screening today with us at Community Health Network. Thank you so much for having me.
Thank you and your team and the Community Health Network and the United Way for partnering with you guys and then allowing, the parking lot there to have you guys set up and do that. Thank you for everything that you've done for the community and continue to do.
Thank you.
This is KHEA Radio, 99.5 FM.